I hope you're having a great Tuesday morning, better than your Monday morning. We are so excited to have you guys with us. We still got some people joining, so we'll give them just another minute or two. In the meantime, if you don't mind to go ahead and mute your microphones. You don't have to show your lovely face this morning if you don't want to, but you get to see ours. Okay, so we will go ahead and get started here, maybe. As I said, welcome to our webinar, Working Together to Keep Kentucky Women Healthy. My name is Ashley Teague, and I'm a Regional Cancer Control Specialist with the Kentucky Cancer Program. I'm joined today by my colleague, Jennifer Wilson, and from the Kentucky Women's Cancer Screening Program, Emily Goodwin and Colleen Toffness. If you wouldn't mind, go ahead and type your name and organization into the chat. We want to make sure we know that you're here. And we also have plans of following up with you after the webinar with any additional questions you may have or materials you may want. We want to thank you for joining us today, especially this early in the morning. Our goal is to let you know about a program for uninsured women that will give them access to breast and cervical cancer screening. In the midst of COVID, we have realized how important our overall health is. We've kind of put that on the back burner, but now we realize we really need to be focused on our health, and we want to make sure that we're overcoming any barriers people have to being as healthy as they can be. And so if you have any questions today during this webinar, type them in the chat. We're going to have a Q&A session at the end of the webinar. If it is a very specific question, again, we won't be giving medical advice, but if it's a very specific question about a patient that you're dealing with, you can still put that in the chat, or you can message it to me or Jennifer or Emily or Colleen, and we will email that answer back to you so we don't take up a lot of time. We really don't want to keep you on here forever. We really want to make this short and sweet. So during this webinar, we're also going to be doing 3 polls just to make sure you're still with us. We know it's early in the morning. We don't want you to fall asleep. So grab your coffee and get ready. The first poll that we would like to do is, let's see if I can pull it up. You all are my guinea pigs because I've never done this before. Okay, so first poll is your organization. So we want to know what kind of organization that you are from, and are you even familiar with the Kentucky Women's Cancer Screening Program? So just click your answers super quick. Oh, wow. We'll give you all just a few more seconds. And Jennifer, if you don't mind to write these answers down. So here is what we have discovered. We'll end the poll and share the results. So, it's a mix of healthcare, community services, some education. That's exciting. And what I'm really excited about is you all are at least somewhat familiar with this program. So that's really good news for all of us who try to promote this program. But our goal is to make you very familiar with the program by the end of this webinar. So thank you. That was my first ever poll. It went better than expected. Okay, so now I'm going to turn it over to Emily Goodwin so she can tell us about the cancer screening program.
Hello and good morning. Give me just a moment while I share my screen. Hopefully it'll work for me. All right, can you see my presentation? Okay, well, bear with me as we click along. I'm more used to Teams now than Zoom, so it's been a while with Zoom. But good morning, my name is Emily Goodwin. I'm the recruitment coordinator for the Kentucky Women's Cancer Screening Program. And from that poll, I'm so happy that most of you do have some idea, or you've heard the name Kentucky Women's Cancer Screening Program. It's a great program, so we'll dive into it. Just give a brief overview, remind you a little bit. All right, so the Kentucky Women's Cancer Screening Program is a federally funded public health program, and we provide free and low-cost breast and cervical cancer screening and diagnostic services to eligible women in Kentucky. Services like mammograms and pap tests are offered through local health departments and other participating clinics around the state. And we've been transitioning, just depending on public health transformation has been a big thing for us over the past few years. So in the past, it's been exclusively through local health departments. And so we've been transitioning into those other clinics around the state, like FQHCs. All right, so this is something new, and the quality of this image is not great. So I apologize for that, but I'll take you to the map here in just a second. We just launched a provider map, and then this QR code in the corner will take you to our website if you want, but I'll show you in just a second too. This is an interactive map of Kentucky, and it shows you where we are located. Let me see if I can click and if it'll take me. I don't know if you're still seeing, are you seeing the screen?
We still see the map.
Okay. New share. Are you still seeing the map?
No, we see your website.
Okay, awesome. So, and I'll put the link to this in the chat as well, so you all can have easy access to it and just play around with it. But you can click on the county and it'll show you the provider location in that county, or like Pikeville, there's multiple locations there. So it'll show you, and then the coolest part is when you click on it, it'll take you to a map. Do you see the map?
Yes.
Okay.
Yeah, it's on map.
Okay, good. So hopefully as providers, if a woman, you know, is like, oh, I live in this county, you can be like, oh, well, there's this county close by. So there's this provider in this county close by. Or you can have the option to just tell her where. So let me figure out how to get back to my presentation. Awesome. Okay. You'd think I'd be used to all the technology by now. All right, so I'll put the link to this in the chat so you all can play around with it yourselves and have easy access to it. But that's just something we've launched like within the last 2 weeks. So very exciting. We've been working on it for a while, dreaming about it for even longer. So I'm happy that that is out there on our website. We have all kinds of partners. As you may know, we have our lovely friends at KCP, Kentucky Cancer Program. They are the boots on the ground and really the extension of us in your communities. So we're grateful for partners like them. Other partners you may be familiar with are Kentucky Community Action and Kentucky Cancer Link. They just help fill in the gaps where our program might need a little extra love in certain areas, and like with Kentucky Community Action, they're helping provide some transportation services. So that's a really exciting partnership as well. So for those of you that are somewhat familiar, you might be familiar with our eligibility requirements, but just to go over those again, women have to be ages 21 and older, a household income at or less than 250% of the federal poverty level, and no health insurance, and that includes Medicaid and Medicare Part B. And here is our lovely poster. Explains all that as well. And so, like Ashley said, if you have any questions, I encourage you to contact us. We love to hear the questions, and we love to find the right answer for you and whoever you may be helping in your clinics, if it's a specific need or anything like that. But we're located throughout the Commonwealth, like you saw with our map. You can call us toll free Our number's there on the screen. And then we have an email address, kwcsp@ky.gov.
Emily, can you talk real quick about payment? So if someone gets into this program, what is covered through your program?
Okay, that actually might be better for Colleen to talk about.
Okay, the program covers
Yes.
screening and diagnostics, not treatment. So for breast cancer screening, the mammogram will be free, and a woman can get a mammogram every 1 to 2 years. Starting at age 40, unless she is symptomatic or if she's high risk, then she can get breast services before the age of 40. And for cervical cancer screening, that would start at age 21. And screening is every 3 years up until with a PAP, every 3 years up until your age 30, and then you have a choice of a PAP, a primary HPV test, or a co-test, which is both the PAP and the HPV test. And that if a woman chooses the primary HPV or the co-test, she would only have to be screened every 5 years. Now that's as long as screening is normal and there's no abnormalities. The diagnostic follow-up is covered, and we have a list of covered CPT codes. So anything on that list would be covered, which our providers have. And every now and then there will be an order for something not on that list, and occasionally that will be covered, but we would have to take that to our program manager and get permission to cover that. Does that answer your question? Anything else?
I think that's good.
Let me add one other thing is one really good thing about this program is if a woman receives at least one service through the program and ends up with a diagnosis of breast or cervical cancer or a precancer that needs treatment, if they are a U.S. citizen or a legal alien, they have not yet reached the age of 65, they can apply for the breast and cervical cancer treatment program to help cover the cost of their treatment.
Yes, that's exactly what I wanted you to talk about, because we have so many great programs for uninsured, but this one actually can get them to a program where treatment may actually be covered. I really wanted to get that information out too.
Let me add to one other thing about that is that once a woman has started treatment, it is too late to get her into the program. So we need to get her into the program, preferably before diagnosis, but absolutely before treatment, even before that first treatment visit.
Great. Well, that's all that I have for my presentation. We are on social media. If you want to follow us, we post all of our news on Facebook and Twitter. And that is it. So I'll stop sharing my screen now. Thank you.
Thank you, Colleen and Emily. Like Ashley said, my name is Jennifer Wilson, and I also am a regional cancer control specialist for the Kentucky Cancer Program. I just have a few minutes that I wanted to share some information about KCP and the partnership that we have with KWCSP. And after that, we're going to field any type of questions that you may have. Like Ashley mentioned earlier in the introduction, if it is a general question, be sure to put that in there and we'll answer that, and we'll go through as many as we can. But also, if you have a specific question that you need answered, you can put that on there, and just because we don't answer it on the webinar doesn't mean you won't get an answer. So Ashley or myself or Colleen or Emily will follow up with you as well. So I'm going to go ahead and share my screen. hopefully. And can you all see that, or is it?
Yes.
Okay, perfect. So like Ashley and Emily, we've reiterated so many times, it's all about partnering and working together to keep our women healthy here in Kentucky. This is our KCP map. Hopefully, if you're on this call today, you have some idea of who your KCP representative is or met them personally. You can see that each of us have our own territory and they're color coded. And you can see their name, their phone number, and their email address. This map of information is in or on our KCP website, KCP East and KCP West. KCP East, you can see that we are administered by the University of Kentucky, and the West is from the University of Louisville. Myself, I cover the 5Co and the Big Sandy area, but we know a lot of our partners and healthcare providers cross these ad district lines. So you may actually be working with a couple of us, and that's great. The more that we can partner, the better. So I'll let you glance there and jot down anybody's information or name that you may see. One of the things that we do as partners, because we do have people located throughout the state, is work with community partners or healthcare providers about getting this information out. And so I'm going to show you guys some of the materials that we have worked with KWCSP to get out in your community. Once this call is over, you will have follow-up from your KCP staff with, I don't want to call it an order form, but basically reviewing these documents and seeing if there is anything that you would like to have for your constituents, as well as if there are any type of community activities and things you'd like to help with. So this is one of the community and general public flyers. I believe Emily had a smaller version of this on one of her slides. Mine's a little fuzzy too, but you can see it just has the eligibility requirements as well as the phone number. So if you're doing any type of outreach event, especially geared towards women, we know as Mother's Day comes around, a lot of places do women's events. This would be a great thing to have. Or if you have those women coming into your clinic for whatever reason, just to have those at your front desk or whatever. So we have these for the general public. This is one more so for providers or for your clinic staff to let them know who their contact person is. You can see this one specifically shows that Winona Pageant. So she covers kind of the Somerset area. And these would have either my information, Ashley's, Amy's, or whoever your KCP rep is. That way, if you do have specific questions, we can help you with. So this isn't something you would give out to a patient per se, but that you would keep in your clinic so that you would have something to refer to and get just the basic general information. This is a great little document for your providers. This is the quick guide, and it has your eligibility requirements for the breast and cervical treatment program, as well as KWCSP, what the program's about. This is great to have in any type of clinic room or when you're working with patients to see, okay, are they eligible? And what do our next steps need to be? So this is a back and front piece. So on the front, you have that information as far as eligibility. And on the back, it is the same map that I showed you earlier with who you would need to contact if you have any questions. Next, we have a patient reminder card, and we worked on this last year, and some of our clinics are actually using this already. You can see on the front, it's just this lovely picture of a mother-daughter, it looks like, talking about scheduling their cancer screenings. On the inside, it has whether that person is eligible or needs to schedule a mammogram or a pap smear. And above that, you can see quite a large blank space. And we did that purposely so that clinics can personalize those to their own needs. So if you want to put a phone number, a clinic name, a provider name, and these are able to be run through a printer, or you could put a label or sticker, anything like that on these cards. And we have these available as well. So to follow up, like I said, we are going to have our KCP staff reach out to all of you on your call today, whoever your representative is, remind you of these documents, see if there's anything that you would be interested in for your business, and also let you know that we're available to come and do outreach projects. So if you're doing a women's event and you want your KCP staff to come and set up and share this information, or if you have an idea of a Mother's Day tea or a breast cancer survivor event, something like that, you'd like us to come and speak, talk about this program as well as other opportunities, we would be happy to do so.
Okay, Jennifer, real quick, we have poll number 2. And it's going to be the outreach materials that you just saw. What are you interested in? So we need to know what of these that you like, that you would be interested in having for your facility. Now, this isn't the order form. This is just, we want to know what everybody is interested in. So if you will take a few seconds to fill this out, and it is multiple choice, so you can pick more than one. We just want to see what everybody likes. Okay, we'll give you just another couple seconds. Okay, let's go. Oh, we got a few more coming in. Okay, let's go ahead and end it. And here are your results. Well, it looks like you all like everything, so that's a good thing.
You know, and that's great, because the more materials that you have, the more we can get that message out there. Plus, some people may not get a reminder card, but they may see it on a flyer or vice versa. And so it's great to be able to offer so many different types of material to suit each clinic. So that's all that we have today. I did put my email as well as Ashley's on there. You can jot that down. But if you have any questions and you want to put those in the chat, now's the time. I do have one question that was emailed to me earlier, and I'll go ahead and start us off with that. And then, like I said, if you have a question, go ahead and be adding that. So I believe this question is for Emily and Colleen. It says, how do we get patients enrolled in KWCSP program when they already have a healthcare provider that begins their screening process? Second part of the question, is it possible after a patient returns for additional imaging and before a biopsy? I'm not sure, or I'm sure we have plenty of people who would benefit from this program, but are not sure how to get them there.
I'll take that one.
Okay.
You can, as I said earlier, you can get a woman, eligible woman, into the program anytime before she begins treatment, but preferably before a diagnosis. So if you look on that provider map, just find a provider, and the woman can choose which one she wants to go to, one nearby, call, make an appointment, and she would have to take her records with her or have them sent over before her appointment, so they can know what's already been done with her and go from there. You can look at that map, or you can call our 800 number, which is 1-844-249-0708, and it's on all of the KCP materials that they've been showing you.
And I put the link to our map in the chat as well.
We'll also send that out with our email follow-up, is the link to the KWCSP map. And that'd be great to like save in your favorites to be able to refer back to.
And I will say on that map, there are a few counties where there are not any clinics listed that that are providing our services. But in those counties, you will find that Kentucky Cancer Link will help navigate women to services that are covered by our program.
Okay, thank you, Colleen. That was kind of the next question that was added. It says, are there any plans for expansion? Because only 4 of my counties have sites in them. So if your county does not have one in that map, you can still reach out to KWCSP and you all can help navigate for that person where the nearest facility may be and any issues that may arise in getting them there, correct?
Yes.
Awesome, thank you. Anyone else have any questions before we finish up for the day? We have a few more minutes left.
If not, Jennifer, we have one last poll. You all have got me loving the polls today. But really, this is probably one of the more important questions that we would like to ask of you guys. Let me do this again. And so this is for future events, and I'll go ahead and launch it. And really what we want to know, would you be interested in more webinars like this on similar programs? Our first thought was, there's a Kentucky colon cancer screening program. Would that be something y'all would like, just a quick webinar on to talk about as well? Ooh, I'm loving the answers so far.
We know that everybody has Zoomed themselves to death over the past 2 years. And so that's why we thought, these kind of quick, shorter webinars to get you the best information in the shortest amount of time would be beneficial, not only to us, but to you as well.
All right, guys, guess what? Everybody wants more webinars. We promise to make them short and sweet, just like Jennifer said.
Well, I have right at about 9:30, and it looks like we don't have any more questions in the chat. I want to thank Emily and Colleen again for joining us and sharing so much great information about their programs. I appreciate all of you all taking a few minutes out of your morning to join us, and hopefully you have got some great information that you can take back to your patients, your clinic staff, your community partners, and share the follow-up. Like I said, you'll be hearing from Ashley, myself, or one of the other KCP staff about getting you these materials that you would like, as well as the link to the map that Emily spoke of earlier. And hopefully we will be able to send you out some future opportunities for these short morning webinars. But you guys have a great rest of your week, and we look forward to working with you in the future. Thanks.
Thanks, everyone.
Thank you all.